Hi, I'm Dr. Corey Welchlin. I'm here to talk to you today about arthritis in the hip. The early findings of arthritis in the hip can be somewhat vague. People can complain of a hard time getting up from a seated position. They can talk about fatigue in their hip, thigh, or even knee as they walk. The farther they go, the more uncomfortable it gets. They have to sit to be comfortable. Twisting might be uncomfortable. Occasionally people have buttocks pain or lateral hip pain, but typically it's groin pain, anterior thigh pain, and pain in the front of the knee. As that gets worse, then people will sometimes come in for medical evaluation. When you do come in, what we'll do is evaluate you physically, see if the pain is from the hip, then probably obtain some x-rays. When x-rays show arthritis and you've failed conservative or non-operative treatments, there may be a surgery discussed. But the things we can do before surgery are many. We do injections into the hip to show that in fact it is from your hip, and also give you medication such as a steroid injection into the hip joint. You may get up to a couple weeks to a couple months to even a year of relief from the injection. Other things include the arthritis medicines that you're familiar with, either the over-the-counter variety or the prescription variety. If those don't work, then we're talking about surgical options. If the arthritis is very mild, sometimes we put a camera into the hip called an arthroscopy, and we can clean the hip joint out through 3 little holes. That may be helpful for certain problems such as loose pieces floating around or torn cartilage in the hip. The other things we do for younger people are a resurfacing hip replacement, which is really new. The resurfacing hip replacement is basically designed like this. What happens is we resurface the cup part with this metal shell up here, and then the ball part is replaced with this ball right here. What that allows us to do is have a metal-on-metal bearing, almost like a ball bearing device. And when that happens, we can get very, very long relief of pain with minimal resection, and that's why it's called a resurfacing technique. This has been done in Europe for approximately 30 years with very good follow-up and very good results. This type of hip replacement is called the Birmingham Hip, and you can go on the internet and read about it if you want. And it's been very successful. It's used usually for younger people with good bone quality or hard bone, dense bone, and has been very good and very good results. Other things we do for hips as we get older is do a traditional hip replacement. This is a model of a traditional hip replacement. This is the shell that goes into the pelvis, and this variety, your bone grows into this little surface area. This is a plastic liner that pops into this metal shell. This is a ball part that fits on this stem, and this stem goes inside your bone like this, and your bone grows into this. Some people glue these in, some go cementless. It all depends on your bone quality and the problem you have. But this type of replacement has anywhere from 15 to 20 years of success to give you pain relief before it should fail or come loose. In summary, there's a lot of things we can do for hip pain, but you need to come and be evaluated by your medical provider to learn what the problem is and what your options are. Thank you. I'm Corey Welchlin.